Hey guys, welcome back to the channel Life After Accutane. My name's Tom and I created this channel to tell my story, share the stories of other people and give tips and advice on how to manage long-term Accutane side effects, or at least share how I'm dealing with things. Before I get going, I should probably insert a little legal disclaimer here that none of the advice that I give in this video should be taken as a substitute for anything that you're told by your doctor or medical professional. I posted a video last weekend where I was sat on the beach and I was sharing some of the things that happened to me and how I'm dealing with everything now. But I thought I'd post another video just to elaborate on that and kind of expand more and tell a bit more of the story, and also a bit more about what you can do or share what I do to feel a little bit better. So I took this very strong acne medication 10 years ago. It's difficult to try and condense 10 years into a short video, but I'll do it by listing some of the long-term issues that I've dealt with. So I took the drug for 4 months, 80 milligrams a day, and I had all the regular side effects when I was on it, all the side effects I was warned about. Bit of back pain, depression, dry skin, peeling lips, that kind of thing. But towards the end of it, I developed quite bad fatigue. And when I came off the drug, that never really left me. And then a couple of months later, my health went into a bit of a decline. I've got a list here of all the side effects that I experienced over the course of kind of 3 or 4 years. So one of the first things I dealt with was IBS with severe constipation. Then gut inflammation. This led then, I think, to a rectal abscess. That wasn't very nice. Fatigue, insomnia, depression, brain fog, dizziness, feeling of disconnection, acid reflux, frequent urination, pale green stools, a red rash on my face, which wasn't acne. It was something I'd not had before. Testicular pain and low sex drive. Those things were probably related. Hay fever symptoms all year round, kind of just an irritated nose, just sneezing, and just anything that got near me would irritate me. Joint pain, acute pain in my gallbladder area a couple of times. One time it happened, it nearly floored me, but when I told a doctor about this, she wasn't too bothered and just told me to come back if it happened again. I had a blood test when I returned to the prescribing doctor after, I think it was probably about 6 months after I took the drug. I returned to the prescribing doctor and told him that I thought that it had damaged me. He refused to acknowledge this and told me that he would do a blood test. So he did a blood test and found that my vitamin D was very low. I obviously at this point thought that was going to be the root cause of everything, so I started taking vitamin D, and it didn't really help. In fact, it didn't help at all. But doctors have a way of speaking to you sometimes that is quite condescending, and he got into my head and made me believe that I was imagining everything, really. So I just kind of soldiered on for a long time until I then felt terrible again. About a year later, I think it was, maybe a little bit longer. It was in the run-up to Christmas, I think, and I think it was about a week before Christmas Eve. I began to feel terrible. Felt like my life was coming to an end, and when I had a blood test again, I went to see a different doctor. He arranged for another blood test and found that my thyroid-stimulating hormone was high. So he told me to go away. Avoid alcohol for a month and just take it easy for a month, go back and have another blood test. So I went back for another blood test that found that things were back to normal. So at this point, I went back to the doctor demanding answers, and he couldn't give me any. He just said that he didn't know why that had happened, and maybe it was an infection that had cleared up or something. So I realised that these guys probably didn't know as much as I thought they did at this point. So I decided that it was time to take things into my own hands, and I started doing my own research. And I think I said in my last video that I googled foods that attack the thyroid. I did Google that, but what I said wasn't quite precise. So what happened was I came to the conclusion that gluten was causing me a problem, and the way that it causes a problem is that it gets through the gut wall and confuses the immune system. It looks quite similar to other tissues in your body, or to your own tissues in your body, and your immune system will then begin to attack your own tissues, and this is known as autoimmunity. And in my case, it obviously was having an effect on my thyroid. So I took gluten out of my diet, and within 3 days I felt a lot better. But this led me down a path of trying lots of things with my diet, and realising that a lot of it was to do with things that I was eating. So at that point I decided to go and see a nutritionist. Before I went to see her, she decided that I should do a stool test, because we thought that possibly I could have candida. So we did a stool test, which found that I was carrying a parasite called Blastocystis hominis. And again, I thought that this was going to be the root cause of my problem rather than blaming the drug. So I began taking herbs and following her diet advice. And I took a very strong probiotic as well called VSL3. I did feel a little bit better, but as I continued my research, I found that nobody really gets rid of this parasite, or got rid of the parasite, without the use of antibiotics. So I sought the help of a doctor in the UK. I was born on the island of Guernsey. I was living there at the time. I've just recently moved to Jersey. So I had a Skype consultation with a doctor in the UK who prescribed 3 antibiotics to be taken at the same time. I took the antibiotics, and it was like someone had dropped a bomb in my gut. It was an awful experience. And by the end of what I think was 2 weeks on the antibiotics, I was passing blood. And my fatigue was just at an all-time high. I felt terrible. So I kind of gave up with that guy at that point, and realised that I now had a real problem with something called dysbiosis. So that's an imbalance of good and bad bacteria. I struggled through for a while, and then I decided to take myself off to a detox retreat in Thailand, just really to have a rest and to give my gut a rest from everything. I fasted for 7 days there, and at the end of the fast I did a colonic and a liver flush. Now at the end of that week I felt amazing. I felt like I was back to my old self again. But they advised me to break my fast with fruit, and that was a bad idea. When I started eating the fruit, my gut was all over the place again. I became severely constipated within about 2 or 3 days, passing green stools again, and it was just awful. So I soldiered on. I can't remember when it was, but I saw a gastroenterologist who put a camera inside me, and just to check that everything was okay with my gut and with my bowel and my small intestine as well. He didn't find anything, so I just ended up with a diagnosis of IBS and CFS, which is chronic fatigue syndrome, and I was kind of just told to go away and get on with it. So I struggled through work. I do a physical job, and then I through my continual research, I found out about fecal transplants, and I decided to go to a clinic in the UK, threw my credit card at them. It cost me £6,000, and I ended up doing 30 fecal transplants. Now, this had a beneficial effect on the fatigue, but it didn't seem to do much for the IBS. So again, I continued for a long time, struggling through my days at work, until I eventually found a video by a YouTube channel called Nature Crazy. They were talking about something called cholestasis, which happens after taking Accutane. So if I just switch to my screen view now, and I minimize this, this is the video here. This is what it looks like. It's called Top 8 Tips for Reversing Accutane Side Effects. And yeah, he talks about how when you take the drug, it causes the concentration of bile in the gallbladder, which then leads to problems both above and below the gallbladder. Let's just find a picture of the human digestive system. So here we go, human digestive system. I can show you what the gallbladder looks like if you don't already know where it is. Let's find some images. So let's look at this one. Let's see if we can make it bigger. No, that's hang on, let's find a better one than that. Let's go with this one. I think I looked at this one earlier. My internet connection appears to be very slow. No, it doesn't like that one. Okay, let's try another one. Let's try this one. Okay. Here we go. Right, so let's try enlarging that. We're going to get there eventually. No, this is no good. This one, maybe. Hey, finally we got one. Right. So, this green thing here, is you can just see, it's going white when I'm putting my cursor over it, but the green thing that sits below the liver is the gallbladder. If that becomes congested with bile, it will cause your blood cholesterol to rise. That is what they're looking for when they test your blood prior to taking Accutane. They test for your baseline cholesterol level, and then if your doctor is thorough, he will send you for a blood test once a month to monitor your cholesterol. If your cholesterol rises, that shows that your gallbladder is becoming congested. If your gallbladder becomes congested, then it will cause liver toxicity and a lack of bile in the digestive system. Bile is extremely important in the digestive system because it stimulates bowel movements, it lubricates and protects the whole digestive system, it breaks down fats for absorption, which helps you to absorb fat-soluble vitamins, which is why I think I ended up with a vitamin D deficiency. And it also kills parasites, which is interesting because I had a parasite. And oh yeah, one thing I didn't mention, the doctor from the UK told me that he thought that the reason why I had a parasite was because the Accutane had affected my immune system in some way, which I guess he was probably correct about there. It also helps to keep the gut flora balanced. So a couple of days ago, I also found a study that was asking the question, It was done in 2006, and it was asking the question, is it necessary to have routine blood tests in patients treated with isotretinoin? Basically what they did, they took 91 patients with acne, 57 females and 34 males, and there was 89 people, so 2 dropped out. 89 people completed the study, and basically they found that in all of those 89 people, their cholesterol levels were found to be significantly elevated after being treated with the isotretinoin, or isotretinoin, however you want to pronounce it. So this indicates to me that everybody that takes Accutane will end up with some level of cholestasis, which will then result in a lack of bile to the flowing to the digestive system. And this article here from a doctor called Chris Kresser, who's been a big help to me, talks about the little known connection between leaky gut, gluten intolerance and gallbladder problems. So basically what he's saying is that when you have a gallbladder issue, when you don't have enough bile flowing to the small intestine, you can end up with a condition known as leaky gut. And this is what I think is the root cause of my issues with gluten and all the other foods that give me problems, or the foods that give me autoimmune type symptoms. Basically, leaky gut is at the root of all autoimmune issues. The latest science is proving that. Leaky gut is a difficult thing to manage. What can you do when you've got it? Well, I manage it by following the autoimmune paleo diet, which is a diet that excludes all lectins. So these are things that are found in plant foods that cause an autoimmune response if they get through the gut wall. Along with that, I have to avoid sugars and starches that feed bad bacteria and cause issues in my digestive system due to the dysbiosis. So the 3 things I follow are autoimmune paleo, keto, so I try to eat a ketogenic autoimmune paleo diet, and also low FODMAP, which is a diet that removes any starches and sugars that cause IBS. If you have post-Accutane issues, I would definitely advise trying an autoimmune paleo diet. And keto will probably help you as well. I'm going to put links to all of these things below. Some things for you to have a read through, and links to a couple of videos. There's a presentation that was given by Dr. Paul Mason fairly recently talking about lectins. That's very useful, and he talks about how you can possibly manage leaky gut syndrome or treat it, which is interesting. And another thing that I should mention is liver flushing. Now, I said I did this at a detox retreat in Thailand. When I found that video about cholestasis, I began thinking about what might be going on with my gallbladder. So I decided that I should start doing more liver and gallbladder flushes. So in the end, I did 7 flushes. After a conversation with a girl who helped me a lot, actually, a girl called Becky. Thank you, Becky, if you watch this. She actually did a series of flushes herself quite quickly after taking the drug. So if you just come off this drug and you're still having problems, then you should really look into liver flushing. As I said, I'll post a link to that below. I think that's all I need to mention, really. I will say that if you are watching this video and you decide that you still want to take the drug, my advice would be to eat a high-fat diet while you're on it, so that you can continually stimulate the release of bile from your gallbladder into your small intestine, and that could hopefully prevent cholestasis, or help to prevent cholestasis, and also avoid gluten, because that can cause a lot of damage to the digestive system, especially if there's no bile present. If you want to know more on that subject, you could have a read of some of the work carried out by Alessio Fasano. It's quite interesting. I'll see if I can find some links to post below the video. So I hope that's helped you. I hope I've covered everything. I'll just have a quick glance of my notes here. I think I've managed to condense everything down. If you do have any questions, you can email me at lifeafteraccutane@gmail.com. If you'd like to be interviewed on this channel, you can contact me at that address as well. And you'll probably find some helpful information on my Facebook page. A couple of years ago, off the back of all the studying I'd done for this, I decided to study towards a health coaching certification. And I'm now a certified primal health coach. I have a Facebook page, which is facebook.com/The Primal Nutritionist, and an Instagram, which is just at The Primal Nutritionist. I share some of the meals that I'm eating on there, and some interesting memes, etc., that you might find amusing. Subscribe to the channel. Keep following what I'm doing. There's going to be more to come from this channel, I think. I'm going to try to raise awareness of the risks involved with this very strong medication. If I had the opportunity to go back and never take it, I would grab that opportunity with both hands, because the last 10 years have been very difficult. But in the last year or so, or the last couple of years, I've made a lot of progress, and I'm happy to say that I am enjoying a fairly normal life again these days, and that is what I hope you manage to achieve eventually as well. And I hope these videos help you along the way to that end result. Okay, so yeah, thanks for watching, and subscribe.